Nigeria Info Talk Station of the Nation, and we are back. Swat is also here with us. I told
Good
you
morning.
she's going to be back in the 8 o'clock hour.
Oh yeah,
Hi,
I'm
Swat.
here. I'm fine. Good morning to you.
Right, and welcome people to Budeshi. At least for the next 4 weeks, Budeshi will be with us 8 to 8:30, looking at procurement issues. Budeshi is the household word or phrase for open it up. We'll be opening up lots of things, looking facts, figures, and reports. Well, today we're opening up healthcare. And we are joined this morning. The studio is actually really full. But we have with us the Deputy Director, Health Systems Support, National Primary Healthcare Development Agency, Mr. Niye Ekishola. Good morning, sir.
Thank you. Good morning.
Also have with us a procurement monitor with the PPDC, Margaret Lawrence. Good morning, Margaret.
Thank you.
And a program officer at the PPDC, the Public and Private Development Center, Ifoma Onyebuchi. Morning, Ifoma.
Good morning, thank you.
Alrighty, so let's hop right in and look at our focus today. Now, I want to start off. Why is it important to trace data as it affects health systems reports? I'll start off with you, Ifoma.
Okay, thank you, Ofi, for that question. And I will start by saying that we are all citizens of Nigeria. We are accountable. This is a country, we don't have any other country elsewhere. The government should be accountable. We pay taxes and we want to see a system that works. We want to see a system whereby you can sit at the comfort of your zone and get information about the roads, about the hospitals, about the healthcare facilities, about access to information, about education, about all projects that the government is constructing across the country. So it is important that we know the locations, the amount, everything that pertains to each project from the comfort of our zones in an open data standard format.
Well, just a bit of background. In 2015, the PPDC had mobilized procurement monitors across the country to look at contracts awarded in 2014 for constructing and equipping primary healthcare centers. And that is exactly what we'll be looking at today. Well, that information was gotten from the NPHCDA, the National Primary Healthcare Development Agency. And so I come to you, Mr. Ekishola. What is your mandate at the agency? What is it that you're interested in? Why is the agency there, and how does it impact on what PPDC is trying to do?
Yeah, thank you very much. The National Primary Healthcare Development Agency is the Nigerian government agency that takes care of everything pertaining to primary healthcare. Primary healthcare is the entry point into the nation's healthcare system. We have the primary healthcare level, we have the secondary, and we have the tertiary. In an ideal system, you go into the national health system through the primary healthcare. Now, what the primary healthcare development agency does is to work with the state government and the local government towards developing primary healthcare systems.
Okay, let me come to you, Margaret. Let me ask you this: how was the monitoring carried out?
Well, it was just like making our time and then go to Delta State, see how it's like, see what's happening to the people. And it was a nice experience. So I went there and somehow you see PACs. Okay, initially I went to Oki and I was like lost. Oh, is this Delta State? It was beautiful. It was fine. You go to Ivory, beautiful place with big ambulance, and I'm like, wow, this is
So
nice.
the primary healthcare centers were good there?
Yes, they were good. But then when I started going in, I was like, God, I want to go back home, because most of these places you find out that they have 2 PHCs. One is very old, dilapidated, and the other one is newly constructed and it's been locked up. And I'm like, why? And then when you get talking to the matrons, they're like, this is what we see, and we need the help of the primary health care to, come in, talk to the state, the local government, and see how they can open it up. And some of them, you have access to at least see through the window, and you find out that equipment are packed in there, stocked with drugs. And you're like, okay, so what's the issue? They said, oh, they don't even know. And then we decided, okay, let's bring it to our findings. Let's come to primary health care, which is supposed to be governing them, and then let's see what they can do. But then I got talking with some people at the primary health care, and I wanted to know based on my findings. Because, for instance, now, okay, you go to somewhere, if there's an emergency, it could be anybody, because sickness, accidents, nothing calls you when it wants to happen. It just happens. And I'm like, okay, for instance, there's no means of transportation. You go to these places, there's no ambulance, there's no bike, even the very primitive places, no bike, no keke napep, no nothing. And you're like, for instance, there's an emergency. How do you, tackle this situation? How do you help? I went somewhere in Oki, and incidentally, I met this woman who they said had a kidney problem, and she was bleeding badly. And I was like, okay, so what can you do for this woman? They said there's nothing they can do. They had to refer her to the general hospital. And I'm like, okay, so what's the general hospital? It's quite a distance. Is there anything you can do for this woman? Give her maybe a pain reliever or something, and they are lost. There's nothing they can do. And I'm like, okay, if I look at it from my understanding, the primary health care is supposed to be like, okay, the closest place for you to get any medical assistance before they refer you to some other place. And they don't have this assistance.
I understand that for any basic primary healthcare center, there are some, things you look out for, minimum requirements for any primary healthcare center. Did you go with that in mind? And was it only Oki that you went to monitor, or were there other places?
No.
What was the situation like?
No, I actually went with that in mind. I went to like 12 PACs, not just Oki.
Okay, so what are some of these requirements? I mean, let our listeners know.
Okay, ordinarily, if it's like a type 1, you're supposed to have basic requirements like the drugs, small drugs like pain relievers, and then you have benches. You have to make it a little comfortable for you, somewhere you can just go and get a little attention. You have the bench, you have some of their medical equipment, a few of them. And then if it's like a type 2, it's supposed to be a little bigger, where you can get an attention, and then they can send you back home, just like maybe a mini clinic. They can send you back home for observation. If you get worse, you come back, and then they refer you. And then if it's like a type 3, it's supposed to be like a clinic itself, but in a smaller way. Then you have the ambulance, you have major drugs. They can give birth to kids over there, and then maybe perform small surgeries like that.
Okay, one of the concerns that we would have is that, just like Margaret has pointed out, sometimes you see that they're really good PHCs. They've been built, they're open, they're staffed, but as she also pointed out, sometimes they're dilapidated or locked up, not staffed, not equipped. And then I think there was one in Burutu was, I think there was a place where there was supposed to be a PHC but non-existent. So what the agency now, how do you marry these, since you actually have the oversight of how monies are utilized?
Thank you. Well, I want to get something clear. You said there was a place where there was supposed to be, but it's non-existent. Supposed to be as a contract being awarded to build?
Yes, the contract awarded.
Okay. I wouldn't know the specifics for that particular site.
Okay.
Yeah, but what I like to point out is that the National Primary Health Care, what we do is we build model primary health centers. Now, the model primary health centers are actually constituency projects for members of the National Assembly. The idea is that we build a model for the local government to replicate in other places. So when we build in a ward, in a particular ward, we expect that the local government will now replicate same in other wards in the local government. And when we build, what you have to note is that we hand over to the community. So as soon as we hand over to the community, it's now the responsibility of the local government and the community to ensure that that facility is regularly maintained. A lot of the work rests with the local government.
governments.
Yes, primary healthcare is actually the responsibility of the local government level in Nigeria.
Having looked at the role of the NPHCDA and what you guys are interested in, how would you marry monies released, findings that you found? What would be your concerns at the PPDC?
Okay, thank you very much. Like he rightfully pointed out, that's the expectation. It's at the requirements. He actually outlined the functions of national primary health care. What our concern as civil society organizations is that what we have and what we see in the data that because what he just spoke now concerns also tallies with the data we have. The data we collect from them on behalf of the Freedom of Information Act says that so type of primary health care is supposed to be in this place. And when Margaret, like the procurement monitor, goes there, you find out that that's not what is in existence. You find out issue like contractors locking up completed primary health care centers because nobody has paid them for that. For example, the Buhari area council, there's a primary health care there, is being constructed. It's supposed to have been opened because you see the status in the documents they provide you that if it's ongoing, you see it there. If it's completed, you see it there. So when you get to the field, you find out that the data they gave you meant that it's completed. It should be accessible to the public, yes, but it's not. So it becomes a problem because their responsibility, like you rightfully pointed out, is that they build, but our issue and our concern is there any form of coordination and synergy between them and the local government? Because we are the one that goes to the field. We are the one that sees the real thing. Primary healthcare should be their first point of contact. It should be a place you see that your auntie, you see that your uncle in the village that does not have money to access private hospitals. You see them. They are the people who access this primary healthcare. But they can't.
Well, already we're getting lots and lots of messages. Here's one from Idu John. Even with the existence of the Freedom of Information Bill Act, so many government agencies still have their activities shrouded in so much secrecy and are not willing to lay bare their information for public consumption. It's obvious that the activities of government agencies are still being hidden from Nigerians, even when they ought to have been informed, even without having to go through the hurdles of getting the facts for Nigerians. There's primary health care centers in Nigeria that are worth quarter of the amount being called that's used to set them up, period, says Idu John on Airport Road.
Yes.
We have a message here from Rex in Guans. He said, hello, there's a primary health care center of great standard that has never been used by the locals because it's on the lock for over 3 years, somewhere in Guaco along Guagualada axis. He said there is another primary health care center in Aguadodo, Guagualada, of about the size of a self-contained apartment that is roughly valued for over 10 million naira. It only serves as a regrouping ground for immunization and net sharing center.
I also have a tweet here from at Ekbebo. I agree with Ofi. This is not about trying. Taxpayers' money is being spent. Hashtag Budeshi. So we'll come back to our guests for your final words in a minute each. I'll start off with you, Mr.
Oh,
Shola.
thank you, Ofi. Now, what I like to say is that the NPHCDA needs to be assisted to perform better, and this is specifically to the government. Let's have our allocation as at when due and even increased.
All right. Margaret, Procurement Monitor who went to Delta.
Thank you. What I'd like to say is the primary healthcare agency needs to put in much more effort. Okay, so if they have ZTOs that say they get back to them to monitor these places, they need to make sure they're actually doing the work, going there, seeing these things, coming back to give them feedback, and then they do follow up, because this thing affects the common man. We want to be able to help to reach out to the primary healthcare, to reach out to the community and come to their aid.
All right, Ifoma?
Yes, thank you. As civil society organizations, we are after better service delivery. And just like the caller said, it's the effort from people. The citizens should ask questions. You shouldn't wait. Even the host communities. How many times have you asked this primary healthcare? If all of us can come out to be asking questions, I think things will go on better. Telling the general public, the citizens, go to our website. You can call us on 070-661-8896, or you can also send us a mail on ppdc@procurementmonitor.org So we're also encouraging public institutions not to relent from releasing data, because without data we cannot do anything.
Budeshi.org, Budeshi, Budeshi, and it's every Friday from 8 o'clock here on the Morning Crossfire. Thank you very much, gentlemen and ladies, for making out the time.